Well, good morning again and welcome into HealthWise, the TV show. I'm your host, Ralph Hipp. My guest today is Dr. Hartej Sethi, and he's from the Cotton O'Neill Neuro Spine Center. Dr. Sethi and his staff help catch strokes as fast and as early as possible. We'll actually show you what that acronym FAST would mean in saving time and saving lives. And they also provide interventions to help our patients minimize their after effects of that. Dr. Sethi, good to have you here.
Thank
Welcome.
you, Ralph. Appreciate
Well, on our show, we always start at the beginning and define what is a stroke and what are the different types of strokes that people might suffer.
Absolutely. So stroke, broadly speaking, is damage to the brain that occurs because there is a problem with the blood flow to a part of the brain. It can be a blockage of an artery that causes lack of blood flow, or it can be bursting of a vessel that can cause bleeding in the brain. Both types of strokes can cause damage to the brain. The most common type is blockage to the artery that causes lack of blood flow. Every time you have any kind of blood flow supply interruption to the brain, you lose millions of cells every minute. So that's why time is of the essence.
We will certainly talk about that and remembering those letters FAST. But about the various types of strokes, Dr. Sethi, and who is at risk for the different types of strokes that are out there?
So the types of strokes can be based on blockage and bleeding. 85% of the strokes are because of blockage of blood vessels to the brain. So that's the main type of stroke that we can address early on. And as far as risk goes, anybody can have a stroke. We do think of people above the age of 65 as having the highest risk. Women, a little bit more risk than men, but stroke is happening more and more in the younger age groups. We're seeing increased stroke in the 45 to 65 year age group, and strokes can also happen in children. 6 out of 100,000 children have strokes a year, so it can happen at any age, really.
Right. Why is it so important to get the treatment right away? What sorts of treatments can we do quickly to help stroke patients?
So time is of the essence, again, because every minute that the brain is not getting blood flow, you are losing about 2 million neurons in the brain. So the faster we're able to restore that blood flow, the better the chances that you will have limited or no damage from that stroke. And the treatment options are also more effective the earlier we use them. The most commonly used treatment is a drug called TPA, which is a clot-busting agent that we can inject intravenously. If we get the patient in the right situation within the first 4.5 hours of a stroke, we can use that agent, and that reduces your disability and your chances of mortality from a stroke substantially. Reduces
that very quick loss of brain cells.
Correct.
From TPA.
Correct.
Well, we have some other letters and the acronym FAST, F-A-S-T. Melissa Bruner has explained this on our 2-year health reports numerous times. So Dr. Sethi, we've got the expert here, ladies and gentlemen, with the face drooping. Let's start with that sign.
So if your face on one side of the body or the other starts to droop, that is a common sign seen with stroke. If you have drifting of your arm on one side, if one arm is weaker than the other, that's another common sign. Difficulty with speech, either slurring of words or just not being able to make sense, both are common signs of stroke. Between these 3 signs, almost 85% of stroke patients will have any one of them or all of them at any given time.
And is it immediately, Dr. Sethi, we should call 911, that's the T, and do the time as quickly as possible to get paramedics?
That's exactly right. T stands, it's time to call 911 if you have any of those 3 symptoms that we talked about.
Right. What can we do? Can we learn anything from your expertise of what do we do to help the stroke patient until help arrives?
So acutely, the main thing is the timeline in which the patient can get to the hospital, giving the emergency medical technicians as much information as you can, figuring out what medications the patient might be taking, what the patient's history might be. If you have access to family members that know more about the patients, for example, are they on a blood thinner or do they have a certain kind of heart condition? Those things can be extremely critical in allowing us to treat the patient immediately for that given amount of stroke.
In that time period, then the paramedics do their treatment, and when we get them to the hospital, Dr. Sethi, what treatments are available, the very advanced state-of-the-art medical treatment for stroke victims?
So there are newer treatments that have been approved. We have been using them for many years, but in 2015, many studies came out in support of those treatments that we call interventional stroke treatments. So they are catheter-based treatments. We take a catheter from the groin all the way up to the arteries that supply the brain.
From the groin up?
From the groin up.
Okay.
And that catheter can deliver medication right next to the clot, or we can use devices to fish that clot out from that artery. And those treatments can be very effective given the right circumstance, the right patient.
That is amazing. Well, we're going to get to our exercises, which can prevent stroke, I'm sure. We'll get to those exercises in a minute. But in our final minute, Dr. Sethi, what are some of the things we can do before to take care of ourselves and reduce our risk?
Absolutely. So the biggest risk factor for stroke, so far we know, is high blood pressure. So make sure the blood pressure is monitored carefully, as well controlled as possibly can be. That prevents your risk of stroke tremendously. If you're diabetic, high blood sugar will result in higher risk of stroke, so controlling sugars is more important.
Control the sugar.
Stop smoking. Smoking is another major risk factor for stroke. Better physical activity, physical exercise definitely reduces your stroke risk. Better healthy eating, more fruits, more vegetables, less red meat, we know has improved outcomes in terms of stroke incidence. And then there are certain more specific risk factors that your doctors can address. For example, sleep apnea, for example, atrial fibrillation, other kinds of heart conditions.
Which we'll talk about next week, right?
Which can also increase risk of stroke and can be managed.
Dr. Sethi, it's been a pleasure to talk with you about strokes and helping prevent them and helping treat them. We appreciate you being on our show today.
Thank you, Ralph. Thank you.
Don't forget those monthly senior suppers at Stormont Vail the second Monday of every month, and you can call 354-5225 to get those tickets for the senior suppers at 5:15 till 6:30. Well, next up on HealthWise TV, it's our popular exercise segment. We've got some fun and invigorating low-impact exercises. Be sure to check with your doctor before you start this or any exercise program.